glad to have you join us today with the LA County Office of Violence Prevention, Trauma Prevention Initiative, Community Action for Peace. This is our table where we deal with violence prevention. So I want to introduce you to one of my, I don't know him, I've been a fan, like a general public fan, and I've been reading his work. It has inspired me on many times, even the entire center, because he asked some of the big questions about social innovation, social enterprise, new roles for community engagement and planning. And I just don't hear that often in other places. So when we got this assignment, I thought, why bring tools and resources from other places? And this would be a great excuse for me to reach out and get to know Dr. Painter and make him aware of who we are and what we do. And then we have a local resource when we need a clarification or something like that. I thought it would be nice to build these local relationships. So he's joined us. You all know the article. We've been talking about this roadmap, this pathway from the model we have to more what we're calling unincorporated neighborhood councils, but more citizen co-production. So we're going to get some understanding from Dr. Gary about what some of that means. And he can tell you more about who he is and what his center does here in Los Angeles. So none other than Dr. Gary Painter.
Well, good afternoon. If everybody is in the LA region, of course, you might be calling in from somewhere else today. It was a pleasure to have just a really neat conversation with Cheryl, and you know, I am very enthusiastic about the work that you're doing. I became the director of the Price Center for Social Innovation, and we can talk about that term later, just because it can mean all things to all people if you aren't too careful. But about 6 years ago. And one of the things that I wanted to do is to be a university partner in initiatives that are comprised by individual organizations or networks that are themselves doing social innovation work. And that had kind of two purposes. One is to learn with those networks and organizations to see how they're able to advance the agenda that they're trying to do. And then also to kind of bring in, research and resources to those community action networks, if you will, just to use a generic term that covers individual organizations and also networks in order to help accomplish their objectives. And just kind of recognizing that in an iterative process of social innovation, you really need these three elements. One is you need to be, focused on addressing some systemic issue. Or maybe more than one, as many networks try to do. You need to be inclusive in your approaches, and that means inclusive in ways that extend to people who have been traditionally left out of particular conversations, who have been ignored, who have been purposefully excluded. But it also includes traditional kind of places where power sits in the public sector, philanthropic sectors, in the economic kind of sectors, capitalism, et cetera, to understand what that bridging looks like. And so that sort of inclusivity. And the other piece of social innovation that's essential is that it's iterative, that you don't simply come up with an idea, advance it, and hope it makes it all the way into policy or practice or community outcome change, but instead that you're going to kind of iterate from kind of co-designing ideas, understanding the situation with people in the community, to co-producing, kind of pilot ideas, thinking about scaling, thinking about diffusion. And the piece that I was able to write with one of my colleagues, Giovanna Rosen, who was a postdoc at the Price Center for Social Innovation at the time, and now is a professor at Rutgers University, was a piece that was trying to note some of the differences between how kind of quote unquote community involvement or community participation had typically been thought of, to what authentic co-production and community power could look like, and trying to kind of lay out a pathway of how do you get there, by looking at those extremes of, the government, and or developers, around economic development projects kind of like do things, and then they come up with a contract for a community benefits agreement or something like that, and then the community gets a piece of some sort of economic benefit. Or sometimes like the extreme version of citizen control might be, oh, here's some money, go figure out what to do with it, but there's not that connection and iteration with seats of power to kind of thinking about that, again, model of community investment that has as its result systems change and also community ownership. So that's what we've been trying to embark on. That article talked about our first partnership with a group out in Eastern Riverside County in the Coachella Valley. We worked with the 2 Los Angeles Promise Zones quite a bit. We worked with a coalition of actors in Southeast Los Angeles, from Sela to ABC to others. And we're, very pleased to, start a relationship with this group who are working with focused on the unincorporated areas of LA County. And just as a side note, before, I don't really know where best to kind of, start to take questions and so forth. But one of the things that we've done is we've launched something through some funding that we received after a few years of effort to convince somebody from Chase, the banking, their kind of community engagement office, is to launch something called the Civic Support Enterprise, where if there are organizations or networks that need a little bit of data analysis to help inform their work, we can go beyond what we've already stood up. And I'll put it in the chat as people are asking questions, something called Neighborhood Data for Social Change, where you can go to the website and download neighborhood level data, however you define neighborhoods. And so if you have a few census tracts over here, you have a few zip codes over there and so forth, you can kind of group them together and say, this is my community. You can then save that kind of mapping and kind of get a sense of what is the trajectory right now in those places. But the Civic Support Enterprise not only provides training for people working in these places in a pro bono fashion, if it is something relatively small, and if it's something larger, then our commitment is to try to help, partner on fundraising opportunities to do that sort of work. So I think I'll pause there, Cheryl. I don't know if there's other specific questions. You know who's in the room. And I'm happy to kind of go in any particular direction or just open it up more broadly. I can certainly share a variety of stories and challenges and where we've overcome and where we haven't in some of the work, with the 2 LA Promise Zones, for instance, or somewhere else.
Thank you. No, I'm just glad that you're here. You're sharing that resource is going to be an awesome guide, and just reinforcing how important it is that we use some of these planning tools to help this group get there. So if anyone on the steering committee, we knew this was a small group, and this is an opportunity to have a direct chat with Dr. Gary about this approach. Some of the things that I think about here is just that, how do we craft our message amongst all the noise? Like you said, there's so many things impacting Black, Indigenous populations of color in LA, and we're focused on violence prevention, and so how do we get pushed and pulled in so many ways, and just trying to figure out, how do we stay focused but not appear as if we're not addressing and embracing all the issues? We get criticism for that sometimes because we're so focused on violence prevention and the things that happen in that area. So as we're going to this next phase of growth, where we're looking to actually be a formal community-driven group, that's why I thought a conversation with you about what is this shift from citizen control to co-production? Like, what are some of the key differences that you've seen to give the residents more empowerment. Like, why do you think it works that way? What's wrong with citizen? Well, I don't want to say what's wrong with citizen control, but maybe we've outgrown that. And I'm trying to get, how do we get system leaders to understand that they hold it so dear, like it's prime teeth?
Well, I'll start there and then I'll kind of take a step back to try to address what you were asking at the beginning of that. I mean, in some ways, the term citizen control that we were kind of speaking against is one that we've often seen where there's funding that's given to a particular group, or maybe it's a neighborhood council, maybe it's some set of actors who have, a vision in mind, and then those economic power structures, political power structures, in some sense, turn away. They kind of look at it as their opportunity to contribute, and it's almost as if there's a little bit of what I would call a charity mindset associated with it. We'll just give the money, we'll walk away. You figured out, oh, it didn't work. Well, why didn't it work? Well, we gave you the money. Why didn't it work? When we know in reality, it's not about the money. If the system, as you were noting, actually intentionally disadvantages Black and Indigenous people of color, and then you give some money to people who are represented there, and something doesn't work, they weren't able to achieve the systems change because they just had some money to address a very specific kind of, I would say, a smaller scale issue, not the systems change. And so the reason that kind of moving from kind of citizen control to community ownership and through a co-production process is so important is that it recognizes that inclusion has to lift up community voice, but it also has to connect it to community power. And the power often sits separate from residents. And if that's the case, if you never solve that power dynamic, then you're never going to actually achieve the goal. So that's one thing that I guess I would emphasize, and we've seen that in our work. I think the other thing to kind of point out is you talked about being maybe pigeonholed and saying, well, you're focused on violence prevention. Are you ignoring a lot of other things? The work that began in the Coachella Valley that's referenced in the article that you've read with your partners here started out because a funder was noticing that the amount of people being served in the food banks around the country kept going up, 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 up. And so they could continue to raise money to pay for food for people, or they could kind of flip that and go, as you are kind of like, well, how do you prevent violence? You don't want to just address violence after it happens. You want to prevent it. Well, they wanted to think about how do you prevent hunger? And what you recognize, of course, is that there's no single system, if you will, from the public sector or a set of nonprofits or anything like that, that is the system lever to click and then all of a sudden end hunger so that you don't need food banks. And in many ways, the goal of that initiative is so that there are no more food banks, right? And that's strange for, food banks to be involved in, let's figure out how to put ourselves out of business. And so you could think the same thing here. There are people that help people who've experienced victimization. Perhaps their goal is that they don't exist anymore, right? And so that means reaching up to systems that have, again, targeted, especially Black people in our city, in our community for hundreds of years. That means that we have to target systems of the quote unquote criminal justice system. You have to attach systems of economic power and finance as it relates to housing and so forth in order to address how you're going to prevent violence. So what it enables you to do is to say, I have this target of reducing violence, recognizing that it's going to take a collective action network to be mobilized around that issue that include actors that may have not been part of those initial efforts. But that's the only way to kind of achieve those goals. And so what the group in the Coachella Valley, what they've been able to do is they've demonstrated that connectivity, that inclusion from residents who are living, farm workers out in the Southeast Valley toward the Salton Sea, who are now participating with kind of people who are running Riverside's economic development department, who are now participating with Governor Newsom's, finance office, because one of the things they're focused on is reducing the amount of rent burden people are facing. So paying less of percentage of their income as rent. And to do that, one thing they have to accomplish is to build more affordable housing. And so it's a great example of how they've iterated around kind of piloting ideas and so forth, and then building power, and then getting to the point where now, one of the goals in the new budget is to have the governor allocate $25 million for affordable housing in that region, because that voice has gotten so strong and vibrant. And I think that's the idea of kind of the community power starting to flex. And it's taken 7 years to get to where they are. But in the scope of time, that's actually not so bad at all, in terms of how collective action networks could work and so forth. To be frank, most aren't that effective that quickly. They really are, just a really exciting example.
That's awesome. And we share some of those similarities. We've been organized by the county, starting with a small investment as well, but 5 years now, Keith, right? It's been 5 years. I see your hand up too, Keith. I would love you to jump in and ask a question. Introduce yourself to Dr. Gary.
Sure, Keith, thank you. Oh. Thanks, Cheryl. Dr. Gary, thank you. I certainly welcome your input and your comments here. Just as a way of maybe a brief intro. So Keith Baker, I'm the co-lead for the Trauma Prevention Initiative out of the Office of Violence Prevention that's embedded within the Department of Public Health here in LA County. I think back and to your point that 7 years to accomplish what you guys have accomplished is in fact amazing. We've been at this for 5 years, and when I first got on board 2015, one of the things we were very clear about, I think we started with $675,000, and the ask from the board was to reduce violence in LA County. And at which point I laughed and said, yeah, with $675,000, yeah, right. Yeah. But I think one thing was clear to us from the beginning is that we knew how important it would be to have and really focus on community engagement in the true sense of that inclusivity. Given that, the community as a whole has been somewhat jaded by their experiences with large systems, government systems, Department of Public Health, mental health, et cetera, right? So we knew that coming in. But I think we were also very clear about the fact that our role was to be a partner in finding solutions and bringing resources to the table and allow the community to have an very direct input and driving an approach to reduce crime within the 4 communities we have identified. That has been quite effective over the last few years, until I would suggest maybe last year, where we've seen the numbers are spiking across all communities across the country. That being said, though, I think there is something that we've definitely seen where even the folks around these CAPs, the Community Action for Peace tables, have been with us for 5 years. That core group is still there because I think they see that we are committed, the small band of us who represent this program and who represent DPH are committed to system change. Right? And that you can address this by, as you say, throwing some dollars at it, because that's what's been done in the past, right? People come into neighborhoods, we have the solution, and then within no time they're gone, right? And then communities left, again, in worse shape than they were before they came in. or another case that you've identified, we throw some money at through a foundation or through a department. We've been guilty of that, and not really engaging community to really make some systemic changes within the department. And I can tell you, and then most of you who know me well, I've shared that frequently, that it's a uphill battle. It's a bitch to try and change these systems that have been well entrenched within the department for decades. It takes a lot of effort and cajoling, and in many cases, having to stand up and say, no, this is the way we're going to do it. This is the way we have to do it. This is what the community needs. This is what community wants. And in other cases, really trying to find just ways of getting around the system. How do we get dollars into the community without them having to go through this long, lengthy RFP processes, right? Where,
Right.
that process alone keeps, maintain the status quo. So, I hear that, and I certainly can appreciate the work that you guys have been doing, and as a way of just saying thank you for being here, and we certainly look forward to working with you in this regard, not just within the CAPS, but further within DPH itself. So thank you and welcome.
Thank you, Keith. I appreciate what you said there.
Thank you, Keith. See, I told you were going to love Dr. Gary. We
have matching beards. That's what it is.
Yes, awesome. Okay, I don't know why the rest of you are being shy. Just any questions? I saw one more hand. Crystal.
I just wanted to speak on something that he said that was very profound. He said that the community have voices, but we don't have the power. And it's very interesting that was stated, because for us, a lot of us felt that we had community power because we had the knowledge, we had the understanding, and we had the connections. But what we are missing is definitely those power connections. And that's how you create real change. So I'm hoping this relationship or this information that's been shared will help us get there, because our voices aren't really being heard by the people, obviously, that they need to be heard by for to really affect the change that we're really trying to create. So I'm just looking forward to this dialogue helping us move in that direction.
Yeah, I appreciate what you said there, Crystal. And, like one of the precursors in my mind to social innovation leading to systems change is to recognize in many ways where the knowledge sits for innovation, where the ideas sit, where the opportunity sits, and that is in the community, like you said. But right now, that's disconnected from those who currently are in power politically, and who where the kind of capitalistic systems are sitting and allocating resources vis-a-vis the market. And so it's that connectivity that is an essential ingredient. It's necessary, but it's not sufficient for that change.
I really appreciate you raising that, Crystal, because it makes me think if we recognize now that input, remember we learned this logic modeling is an effective tool for planning at the level that we're planning. So one of the inputs that you're making it clear is that we have a power analysis. And do we have the tools to do that? What are the best practices of power analysis? Is that being more self-aware as individuals or community institutions? Like, that's still a blind spot. And I don't think it's as mechanical. It's measurable, but there's also some faith involved there too. So I think that is I really see that as a next step that the CAP organization, we as individuals and leaders, we need to better understand power dynamics. And if we could, even Keith, we could mark this as a point in time from baseline 5 years ago till now. Once we profile all the demographics, then it's all of us didn't have that collective understanding. It took 5 years. That's a theory of change. So if you assemble more than 30 individuals and groups from a targeted community, right? You know, from baseline, we can say that. So that's what I heard Crystal say. You know, it took that long for us to think that, oh, just because we're at the table, like that was a profound, I think you hit it on the head, Crystal. That's the critical thinking now. So we're not in the trance. Remember, I used to say it's always this nursery rhyme. All we hear is Mary had the little lamb, fleece white as snow. Where he went, the lamb was sure to go. How could his feet be white if he's going everywhere? Does he have on shoes? Is he flying? You know, is he levitating a little? And so you remind me of that original analogy we used and how now it's more critical thinking. So Keith, I think that's so important for the county to absorb that part when other departments that you're working with and leading all these county departments through this reimagining, this next step of co-production means that we openly discuss power dynamics.
And thanks, Cheryl. As I said earlier, you know, those in power want to maintain power, right? The system is designed to maintain itself and to kind of maintain that status quo. And it takes time. It takes people on the inside and it takes people on the outside. It takes that collaborative effort to make these systemic changes. So again, you know, I'm pleased to see where this particular group has come in the last 5 years and where we're heading. Certainly, I think we have ensure that the voices from the community is getting all the way up to the top. You know, Dr. Ferrer is hearing you know, and we're again trying to make changes within so that it is shared power, and which is difficult. I might add.
But you know, critical thinking is famous for being difficult, my friend. It's not the what yet, it's the why, which is where I think the academic partnership can help us. And guys, you know, as we slowly come into this collective understanding, you know, this relationship, I'm hoping we'll get into one of these pilots with the USC Center. They're doing some amazing things. And I think that we as a group, as a local stakeholder, have matured to that point where collectively we could be involved in one of the experiments with the USC Innovation Center about ways to prevent violence in LA. It's a timely discussion, and it's this watershed moment, what do they call it? Perfect storm, where we have real data that violence is up in this past pandemic year, and we have new resources being reimagined and reconsidered, and we have a mature community table with department and potential academic partnership, and we could really, that is the new thing. So I think we're right on the edge there. We're gonna keep doing our part, but I'm glad that my hunch, I'm the community partner, Dr. Gary, and I am at this table like everyone else. I started out, our agency, we're a small faith-based, less than $500,000 budget annually. And when I first applied to be a community engagement lead, we didn't make it. I didn't understand exactly how to put my proposal together for the county to accept. So Keith, he kept kicking me in my knees. And then in the third try, 3 was the charm. We finally got there. And this was what I wanted to bring, that another fresh perspective to the conversation. And so even myself, I'm an example of what it takes to get here, sit here, figure it out, you know, and now I can be a bridge for my peers who really have the subject expertise, the lived experience, you know, those things that I can't do, you know. So it's so nice to be able to talk to you. One more thing before you go, because I'm looking at the time, you have a chart in the article, and I wanted you, because I want to use that in our next presentation to Keith and the county, and I've been holding off because I wanted to have this talk with you. Like, I just wanted you to explain a little bit about that, if you could tell us like the difference. I'm going to put it up right quick, and then give you a chance to maybe explain that to us. If you guys just give me one moment. Any other questions or comments?
Kevin has a question there while you bring it up.
Yes. Yes.
Go ahead.
No, go ahead.
So my question is, with the expertise that you have, the exposure you're doing in Coachella Valley with the moves that they're making, our community systemically has multi layers of, and like you said in the beginning, if your goal is to try to eliminate and be put out of business, we've been at this for the task force has been 15, 16 years now. The impact has been favorable, but realistically, from your chairing the committee and the educational piece that you do, realistic, with all that's going on right now, the efforts that have been with the mental health and all of that, the rest that we have components that we must get use out of. With the systemic part of it, you talk about systemic, racially motivated, the 1% now have just widened that gap. The monies that they're trickling down, like you said, you might address a part of it, but never to the root causes. As much as we are identifying what we know to be root causes, where can we pick your brain to not waste time on things that are not going to create the change, systemic change we need? Do you understand my question?
I think so, Bruce, and I'll try to begin an answer, and if I'm off track, just reel me back in.
Okay.
I think that.
Thank you for what you shared. I appreciate your perspective.
Sure.
And the educational aspect that algorithms will tell you whatever, right? And you use algorithms and all of that.
I have partners that do. Myself, maybe I'm a little too old now to actually program with all those machine learning tools. They all sound kind of weird. Random forest and neural networks and all that kind of stuff. But the good news, I'm at USC. I can hire students to do that.
Absolutely. I agree. That's why I'm trying to pick your brain.
Yeah, I don't know how to do it, but I understand what's happening theoretically. I just can't program it myself.
Absolutely.
Yeah, I was just going to say that, one of the things that, kind of thinking of, and I dropped a couple other links there just about collective impact and principles and the example of the work that we are in some sense the backbone for around the research network that is advancing solutions to ending homelessness and kind of that work, which has a very similar sort of what I would say is a goal that seems elusive, right? Your goal is to end violence, right? And so you can kind of see, wow, that's out there, and we have to change systems in all of these ways. In many ways, the same thing's true with homelessness. Like, we have put ourselves in a 50-year hole here, and it's going to take some time to get out of it, and we need to take those deliberate steps. The key, like in this framework, and I think you've done a lot of this work already, is to kind of have that common agenda and shared vision. Then you identify like who needs to be in the room here, and like we could look around and are there people from the sheriff's department? Are there obviously there's people from public health and DMH and DHS and community members and nonprofits that represent work in the community, etc. You have to kind of decide on a shared measurement scheme that says these are the metrics we're going to look at. And certainly the top level metric is violent prevention, but there's a whole bunch of other things that we know from research, kind of actually predicts violence, whether it's economic insecurity or whether it's, mental health episodes, those kinds of things. And then to track those metrics. And then as you're working together, you'll kind of report to each other, what is it that we're doing collectively that's kind of reinforcing these goals and these metrics. And then when you have a pandemic, which, basically just, throws everything out of whack, you can also say, okay, well, maybe we've jumped off the trend, but how do we get it back to those efforts? What needs to be done? And sometimes it does mean there's certain resources that need to be activated. Sometimes it means I need new partners that I haven't been talking to. I have to bring them to the table, and the way that you then communicate continuously with each other, as Keith said, social determinants of health, absolutely, right? And so it's likely that, that sort of like focused activity helps you march on. So when the Coachella Valley came to kind of deciding, well, how are they going to address rent burden? They had this metric, which is, we want to reduce the number of people paying more than a third of their income as rent from whatever it was at something like 55% down to 40% over the next 10 years. They then said, okay, well, one thing we have to track is how many units of affordable housing were built. And so you can activate work around there. And then there's other people who are working on economic opportunity issues that are going to address the other side of rent burden. Like, are people, if you're a farm worker for a part of the year, and then you do a little bit of work on, in a hotel or motel cleaning rooms, but then you have this really uncertain income, you may not be able to get there. So you have to think about what that looks like for people who are residents. So I think it's that kind of focus, that determination, actually being, in some sense, a little bit dangerous by advancing metrics that saying, this is how we're going to keep ourselves accountable. When we did that with the LA Promise Zone, we went through a process where we identified top level metrics and then like 5 or 6 metrics underneath, and said, okay, this is how we're going to do it. And that meant from, all the way from, what they call kind of building livable communities, to work and economic opportunity, to education, et cetera. And we knowing that all funneled into having communities be stable, healthy, and thriving, and around those sorts of goals. But yeah, I mean, it is a collective effort, and sometimes you look around and you're like, what, we need a few more people here because they're not here yet. They need to join up and move forward there. Did I come close to answering some of your thoughts there?
Yes, thank you. I appreciate the fact that you're available for us to pick your brain, because having done it and worked with that, you understand where we're trying to go. Even though we've spent years, Keith has been there 5, but we've been there 15, 16. I retired from the sheriff's department, and now I'm trying to plug back in from a social strata, to make sure that we're implementing things that are going to mean something, or why are we doing it? But thank you. You did answer. Thank you.
Thank you.
Kevin, I see your hand up. Thank you. We still have time for a couple more questions. Kevin?
Well, Bruce just, he just answered my question. That's what I was going to ask. So I ain't got to waste some more time.
Awesome. Bruce, I think that was a really good question, because as we develop this information, that this best practice, or even if it's just an approach, then it's going to inform other groups like yours, like the task force that has been working in South LA for 20, 30 years. And part of our anecdotal observation has been, the older you are, the more they struggle with these concepts, right? Because there's a higher value on the mother wit, so it's disproportionate to the other tools that could come in and help us accelerate forward movement, and greater collective action and greater power and influence. So I'm so excited, because this is where the CAP group will be able to tell that story to your peers. And so now it's a 20-year plan with advisors and tools from like USC now that we can access. We couldn't access like that before, and now we can. And so you have these other co-thinkers. They're co-thinking. That's what the co-production is. It's an acknowledgement. It holds space. Remember this brave space for this co-thinking, this co-communication, and then how do we use that? So we're doing what we want to do. We first answer, why are all these things happening to Black, Indigenous, people of color? And then we can have a what, right? So it's so exciting. It's getting at that why. And I think that's where the echo chamber, and then having these tools, these institutional tools. And some of you are so good, you're going to innovate on them. I just already know that's what you Black, Indigenous people of color do. You're going to innovate on some of this and have it doing things that we didn't think of, and we'll be all the more richer, for that. So,
Sure, can I say something there?
Yes, please.
Something that, of course, triggers me. We did have that connection to USC through Pete Carroll and Bryan Center. But when Bryan Center was removed from our availability to access resources at USC, Pete Carroll moved to Seattle. Of course, his influence and all of that went with him. He tried to stay connected to a community. It's difficult to be in another state and service people the way they need to be serviced. That's why I'm so excited about Doc, because he's actually there doing what we know is great work. He's involved, he's local, and we can touch it. So we did have that, but that was my reason why I asked that question. When we're on the pace to try and do things and make, and we were seeing, when we formed the task force, when we put the group together, when we did all of these things that you mentioned before, then critical pieces were removed from our community, right? And you need resources like Doc there that has access to all of that information, because that's what we have to lean on and build a foundation from. So if somebody leaves, like I retired from the sheriff's department, I still have access, but it's not the same as when I would come in there or wherever we went and did whatever we do. So it should not stop because one or two people move, die, whatever. The progress has to continue to make the systemic long-term, 20 years, you mentioned the changes we're talking about. So I just wanted to share with you, we did have that with Pete Carroll and Bryan Center, who we had their ear to question or bring in. I could bring in anybody from the county and even the city. You know what I'm saying? So we needed certain things, but to have him is a really, really important tool for where we're trying to go. That's all. I wanted to say that.
Thank you, Bruce, that's why you're our institutional memory guy. Thank you. But you're right, and you make me think about. That's why I think this institute is good. It's time we reach out to SC because it's the institution. It's not the individuals. Many times our community-driven solutions took on the personality of the charismatic individual, which we need those individuals. So it's not an either or. Remember our basic core values, it's both and, right? It's about our self-interest. And that data, those guardrails of self-interest guide our steps and our collective brainstorming, this whole co-production. So these are new habits, coming out of our community institutions. We just weren't prioritizing it that way. So now you're right, it's a long walk together. We're all stakeholders in helping us get through this recovery. So I think this is, and addressing violence prevention in particular. So, man, Keith, I'm so excited. Okay, I can write my report now, Keith. I got. I was holding off, like, I just want to have a conversation with Dr. Gary. Okay, so I want to show you all remember this because we've so had reading circles about this model, the co-production. So I want to share the screen and then ask Dr. Gary to just grant us a few minutes and then he had a busy day today with some of his funding team, and he took the time to sit with us for about an hour. So this is the chart, folks, that I'm trying to adapt for us that we've talked about. So Dr. Gary, I don't understand the right side, which is the models of community investment and what its relationship is to the other two. And I was just hoping you could give us just a little guidance how to unpack that.
Yeah, no, that's a great question. And to be quite honest, like how to illustrate the dynamic, iterative, inclusive model on a two-dimensional piece of paper is really, really hard. And you can have arrows and you can have lines and you can have all that, but it's still difficult to say the least. What's on the left is, in some sense, a little bit of a straw man, but it's also saying, these are the ways that we tend to do things. So on the left is you have, I had mentioned before, like what I call community consultation, where, a group who has power, whether it's developers, government, whoever, comes to the community and says, oh, is this the kind of development you want? You kind of get their input and so on and so forth. And then there's some sort of agreement. And then that agreement then would give citizens something, like it could be, again, that's the resource idea. Like, here's your resources, and there's plenty of examples of that. When they built the Staples Center, whatever it was, 25, 30 years ago, the people in the Figueroa corridor got some money and, they had some control over that money and something happened, but it was not iterative. It wasn't inclusive. It was just kind of a moment in time, resources exchange, the citizen, groups then had money to spend. The other way of kind of thinking about it is below that. Those two are not the co-production model. That one on the right is. And the citizen kind of pure control is that you have kind of partnership around kind of, that comes together and then tells the government, you do this, you do that to the developers. Again, it's like one directional. The co-production model is on the right side. And the right side is noting that you got to start with, where is the problem we're trying to solve? That's kind of that community needs assessment piece. You then come up with ideas and solutions called co-designing those, and then go through a process of co-designing those solutions. All throughout, there's, multiple stakeholder engagement to move from understanding the problem to coming up with ideas for solutions. And that connection, that's why at the bottom it says economic and political power, is that's being infused in that step of the process. You then go up to maybe deciding to, well, I want to take this idea and I want to pilot this idea. We think it could work and it could work with these folks. And so you figure out the best way to implement that pilot and to evaluate that pilot. But what you see here is the kind of recognition that as you're moving through a process of change, you are as likely to reflect and move back as you are to move forward. It is not linear. You don't just sort of come up with here's the problem, here's an idea, let's pilot, let's figure out the best pilot, then scale it, and then the system changes. Instead, you iterate back and forth, back and forth, back and forth. And I think importantly, you should have funders, you should have people with economic and political power recognizing that you're going to be iterating. Because part of what happens in a pilot is you learn that you didn't understand the problem. And so you have to go back to the beginning because you tried something new. You're like, oh, okay, that's what was going on. So you go back and then you, again, engage stakeholders and come up with a new idea to pilot. So that's the idea of the model of community investment, which is co-production. And then, at some point you do start to see successful pilots. And again, if you've engaged stakeholders throughout, then sometimes it involves like, okay, now a government department, the Department of Public Health says, actually, we're going to do this. And we're going to do that with these parameters because we've tested it in these ways. And then we're going to, Keith will talk to his boss and then maybe it becomes a practice writ large. Maybe it starts in unincorporated areas and it goes everywhere. That sort of approach was here. But the important part is this connection from, of the economic and political power structures to be part of the stakeholder engagement that enables you to activate what you need to once you have successes on the early stages. And when you have learnings on the early stages, and I don't call them failures, because that's not how innovation works. Like whenever you're trying to come up with a new drug to to reduce the symptoms of COVID-19, it's not like they tried one thing, it didn't work, and they gave up. Right? They tried 100 things, and a few of them have started to reduce symptoms, but most of the early stuff didn't work as far as my reading. Whether it was that malaria drug, the hydrochloroquine, or it was remdesivir, or it was this, that, the other, it turned out they didn't work. You had to try it. You had to learn. You go back to the drawing board and you come up with something else. So it's kind of like recognition of this is the process we're going through. Who needs to be at the table? How do you inject economic and political power at these stages, and then iterate until you're ready to move forward. So that's the idea there.
Oh my God, Keith, did you hear that? That took 20 minutes, dude.
That's amazing.
Dude.
That, you know, it really and truly speaks to the approach we've been taking over the last 5 years. And I think, Dr. Painter, to your point, it's not a linear process, right? There are setbacks. There are times that we need to go back and revamp and revisit and remodel, if you will. But I think the thing that is amazing to me is that, you know, there's a clear path that's already laid out, if you will, to systemic change. And you know, as you point out, it takes time, and it takes pressure, it takes political will, it takes, you know, advocacy from the community level and at our level, for that matter, internal and external. Yeah, it's nice to see in a formal model, if you will, of what we've been doing. Mine didn't particularly look like that, but
I think Dr. Painter should be invited to the all violence prevention team to give a short presentation to some of those individuals. And you may want to circulate the reading ahead of time so they can have questions. And I think that would be awesome.
Yeah, I can see a number of places already, Dr. Painter, that certainly would like to have you at the table. So please know that we'll definitely be in touch.
And the whole institute and the geo tool that they're using. Okay, I'm not promoting, he doesn't pay me for this, but I'm just saying, if I can do it, I'm 12, okay, right? Okay, if I can do it, anybody can. Awesome sauce. Well, this has been more than I planned on, and so reassuring that this was a good path to take, great tool. And this is also a lesson, folks, in how to use evidence-based practices. We don't have to create them. We understand the why, and then we can use these tools to help us create the what. What is the response, right? And so I just want to thank you for embracing this, for trusting me to bring something off the beaten path to our group. And thank you, Keith, again, for allowing us to have some leadership, some co-production in this phase of the work. And Dr. Gary, I just can't say enough about you. You're awesome.
Very kind, Cheryl. Thank you. And I look forward to following up with you as you continue your work. I mean, if there are lots of things I don't know, but you know, there's other people around SC that may know them, or even UCLA, or you know, as the case might be. All right, take care, everybody.
Have a good day.